All right, Amy, I have aches and pains just watching you work out. That's how good a shape I'm in right now. But let's talk about pain. Sore shoulders, achy hips, throbbing knees. They're just a few of life's little reminders that you're getting older, right? Well, maybe not. There are 5 aches and pains you should never ignore. Orthopedic surgeon Robert Bayless from Baylor Regional Medical Center at Irving joins us now. Dr. Bayless, thank you for being here.
Good morning.
So we're just supposed to accept it if we're feeling sore and in pain, right?
Well, Rob, many people live with pain because they believe that it's just a natural part of aging, when in actuality, pain can be a sign that our body is having a problem that needs to be treated. Many patients avoid coming in to see a physician because they're afraid they may need surgery, when actually, if you come in early, it's less likely that you'll need surgery.
So the longer you wait, the more likely you're going to have the procedure that you're trying to avoid in the first place,
Quite
right?
often.
All right, well, let's talk about the top 5 pains that you should never ignore. And the first one that you mentioned is shoulder pain. So what are the symptoms that you shouldn't ignore with your shoulder?
It's that deep aching pain in the shoulder, the pain with reaching up overhead or reaching behind your back, such as to put a coat on or to grab the seatbelt in your car. That quite often can be caused by something called impingement syndrome, and quite often it'll wake you up at night.
Well, all right, tell me about impingement syndrome. Why is that dangerous to ignore?
Well, impingement syndrome, if left untreated, can lead to a rotator cuff tear. If the cuff tear becomes large, then it can lead to permanent weakness and decreased range of motion of the shoulder, to the point that you might need a shoulder replacement.
So if someone comes in early enough, before they get to that point, what can you do to help treat something like that?
Impingement syndrome can be treated as simply as giving someone physical therapy, anti-inflammatory pills, and occasionally a steroid injection.
All right, so let's move on now. The next one that you mentioned that we need to be concerned about is hand pain and numbness. What can that be a sign of?
Well, carpal tunnel syndrome.
Right.
Everyone's heard of it.
Everyone's heard of it. Nobody really knows what it is. So now here you're going to find out. Carpal tunnel, what is that all about?
Exactly. It's compression of the median nerve in the carpal tunnel, which is located over the wrist or proximal palm. When it becomes severe, it causes numbness and tingling in the hand and sometimes weakness. It quite often wakes us up at night with the pain and symptoms.
And again, that's not just a sign of aging, that's a real condition that can be treated. What do you guys do for carpal tunnel?
Well, first, if you don't treat it, it can go on to cause permanent numbness, tingling, and weakness of the hand, even hand atrophy. The treatment for it, when caught early, can be as simple as a cock-up wrist splint, which holds the wrist out of full flexion or out of full extension, which can cause compression on the nerve. Anti-inflammatory medications can also help.
Okay, well, let's move on down the list. Next is knee pain, specifically that catching, locking, the instability that you feel. What's that a sign of?
Well, many things can cause it, but tears, loose body, or even an untreated anterior cruciate ligament tear are common causes.
So what do we do, and what can you do with that if you catch it early enough?
Well, all those problems do unfortunately require surgery, but it can be a simple day surgery arthroscopy. If left untreated, it can lead to severe arthritis requiring a total knee replacement.
So again, the earlier that you come in and have this conversation, the less severe that treatment is going to need to be.
Exactly.
All right. Let's talk finally about hip pain. That's the last one on your list. What is a hip pain a sign of?
Hip pain can be a sign of many things, but the one I want to talk about is something called trochanteric bursitis, or just hip bursitis. It's that pain that's in the lateral aspect of the hip, can go down towards the knee. When it's severe, it'll wake you up at night when you roll over on the hip.
And then the last one, aching legs. You said aching legs, walking also could be a problem?
Yes, it can. It's seen quite commonly in elderly where they just can't walk very far. They tend to walk stooped over. This can be caused by something called lumbar spinal stenosis, very frequently seen in elderly adults.
All right. Well, don't just take it for granted that there is nothing you can do. If you want to find out more, make an appointment with an orthopedic specialist at Baylor Regional Medical Center at Irving. You can call 800-4-BAYLOR or log on to BaylorHealth.com/IrvingOrtho. Up next,